Hello everyone, welcome to the Indian Osteopath Show. Today's guest is very special in the world of osteopathy. He's the founder of Bodymove Clinic and creator of the Adamonis Osteopathic approach. He also specializes in pain management and he has his expertise in women's health and pregnancy care. He goes all around the world teaching from his experience and expertise, and he took a excellent 3-week seminar in Sri Sri University, and right now is in India joining us at Sri Sri University, Kestutis. We will be addressing him as Kes during the podcast.
Happy to be here. Jai Gurudev.
Well, first things first, every superhero has an origin story. So, what's your origin to osteopathy?
Well, I would not call myself a superhero, but I think, I come from more a medical background, right? So naturally, my father is a doctor. I was directed to that pathway maybe to become a doctor, but very early what I realized was that even though medicine has a lot to offer for people, one thing that I would find missing is actually trying to focus more on health and making people feel healthier. So then, when I came to know about osteopathy, one thing led to another, and then I moved to London around 11 years ago, and then I joined the British School of Osteopathy at that time, and then I studied osteopathy for 4 years, and actually that's where I find that the match between focus on health, manual therapy, really met my values. And then when I started studying, I really found that this is exactly what I'm meant to be doing. And 4 years later, I started practicing, and then everything started from there.
So, you were on both sides of the coin. You did medical and osteopathy, and you feel osteopathy brings to the table more in terms of health, which you couldn't have received in a hospital setting?
Yes, I think the main focus of osteopathy, what the founder of osteopathy was saying, that Andrew Taylor Still, he said that everybody can find a problem, but not everybody can find a health. So that health focus, I think, is something that is very important in the world of osteopathy. And I think that's why, osteopathy is still a rather young profession. It's over 150 years old, but it's already, being spread so much through all different parts of the world, from America to India now.
Yeah.
And I think more and more people need to know its benefits.
Well, it's still pretty new to India because in India, if we say manual therapy, it mostly comes in terms of physiotherapy, chiropractors, or even the massage therapist. So, maybe in simple words, can you explain how osteopathy is unique and different from these?
I think the easiest way how I would try to describe osteopathy for an everyday person would be you're like a body engineer, right? It's not about the technique that you do, because physiotherapists, massage therapists, chiropractors, and osteopaths, we all use hands-on approach. So it's very obvious that a lot of people might find it interesting. So what is the difference? But osteopathy, you need to have the knowledge of interconnectedness of the whole body as one mechanism, like one unit. And when you have a problem or pain in the body, instead of just looking at the area which hurts, you try to understand all the links associated with that pain. And then when you're treating the body, you're not treating it as one local area of problem. You're treating a body as a whole. And that wholesome treatment can make such a tremendous shift in such a short period of time. And we had this in the training where we actually took a challenge, like 2-minute challenge, and we had different people coming up with different pains, and they had all these approaches before, but it suddenly just 2 minutes of osteopathy could make 80% of improvement in pain. And I think this is what is really valuable for every future osteopath and present osteopath to learn.
Yeah. And that's one of the reasons why I call you superhero, because I was seen in the seminar where the person who used to play basketball, he was like just able to lift till here and it was painful. And you just treated 2 minutes, maybe, the right points, like how you said, it's more integrated. And he was like just able to do this completely. So,
And he had pain for like over a month, I think, or a few weeks.
If someone just looks at that segment, they would, maybe see like, oh, that's magic. They would not understand the science behind it.
And not only I work with women's health osteopathy, even though this course was about women's health, but I also, for many years, have specialized in chronic pain. So a lot of people, they have pain for so many years, or maybe they have some treatment, the pain goes away, but a few months later, the pain comes back. So what I find fascinating, which was very interesting to me when I actually developed the Adamonis osteopathic approach and I started implementing it into practice, that even those people who were having chronic pain for many years, they actually started to improve significantly. And I would come back home and I would speak with my wife and I would say, "Oh, I met this lady and she had pain for so many years. Now it's 4 or 5 sessions later, she's like 80% better." And it really sounded like a miracle. But suddenly I have another patient with another problem coming through the door and another. And then you almost like have miracles every single day. So then it actually becomes that it's just much more than a miracle. It's actually a very deep and profound science and understanding of how the whole body works as a unit.
So even you must have seen cases where since you have been also able to create this unique segue of taking your approach towards osteopathic principles, where you just founded your way to approach. So in that process, like you were trying out on patients and you were like every day shocked with the results, like you weren't expecting.
Well, in some way, yes. What I found very interesting was that if you come back to the roots of osteopathy, the founder, Andrew Taylor Still, he was giving very clear principles about the body. He actually saw the body, that the body is like one mechanism, it's made out of different parts, and it's like a machine. And the most important thing is to put every single joint and joints and bones in the right balance and place. And then, because it's a mechanism, it will move well. But when I started studying osteopathy, what I was not actually taught was how to do that. Because it seemed that the founder was also more interested in teaching the principles of osteopathy so you not get stuck onto those techniques. But I didn't feel that those techniques were also passed down along the years. So even in one of the best colleges in osteopathy, you will still find that the approach is more focused on mobilization and manipulation of the joints, the working in soft tissues and muscles. But that sort of idea and concept of how to realign the joint surfaces and how can you actually be sure that you have done it was somehow missing for me. And that's why when I was studying, I was really trying to find this answer, how to do it. And it took me around 5 years to figure out the system, how it works. And when I sort of combined those principles, what Andrew Taylor Still was saying, and used those techniques that I've developed in the clinical practice, and suddenly it really worked like magic. So it's in one way it is new, and in one way it's actually just getting back to the roots of osteopathy. And somehow I was lucky to figure it out.
I have seen it in live how quickly that approach was reducing so much of major trauma also, like even with accidents, the muscle tears. I mean, that's something severe, that's like grade 2, grade 3, and still with this gentle approach in 20 minutes, it just became so easy. So that was actually very mesmerizing.
So that's why it's very important. I find a very important role in teaching. And I think I find more passion in teaching now rather than just treating patients. Because, to be clear, is you only have a limited amount of time and you can only see a limited number of patients. So I sometimes tell to my students is like, if you have a 200 patients list that you just see once a month a patient, you now are booked for the rest of your life. But what about other people in Europe, in the UK, in the world, in India, for example, have so many billions of people. So by teaching and sharing this knowledge, you can actually make a true difference in people's quality of life and health. And that's why I'm very passionate about teaching and sharing all of this method to all the students.
In this 3 week seminar, like definitely your teaching has it let me unlearn so many things and relearn, because I've been practicing, but when you told, the things really hit in a very different way, like the perception, the perspective of it itself changed completely. And we actually covered very important aspects these 3 weeks. Like we covered pregnancy, we covered hormones, we also did a little bit of the elderly care. And right now in India, I think the most leading a concern for women is in terms of PCOD, or in terms of hormonal issues, period pains, and all. So, in your expertise, how much of the percentage did you see of these symptoms getting relieved, or maybe like the whole disease getting reversed?
So I think maybe what is good to be very clear is in osteopathy, uh, all great science initially starts from clinical observation when treating patients. So, for example, when it comes to actually treating chronic pain, musculoskeletal pain conditions, we actually do have some research to support that osteopathy can work with that. And then when I'm applying my approach of restoring the balance of the body, you can actually see quite tremendous results. So when it comes to treating women and women's health issues, surely I've noticed in my practice that the period pains get much better. Like from 8 out of 10 every month, it can go to like 3, 4. Bladder problems and continence issues, you can actually help to improve them so that, women can actually feel much more comfortable going out, dancing, and just living the comfortable life. Um, Pelvic floor pain, you can also help. Pregnancy is also very important because in osteopathy, you're not just looking into just relieving a little bit of tension, but you also want to ensure that mom has the most healthy delivery possible. And if there are any restrictions in the joints or tissues that are stiff or tight, that might also make the delivery process a bit more challenging. So in my clinical practice, I have noticed that all of those things can actually get better and improve. But again, that's what I said. When you start something, first of all, you start from noticing what works. Then you start sharing, and osteopathy is still quite a new profession.
Yeah.
So we need more research. And I think the most important thing is to see where it is, to start sharing and seeing how it can actually help women. And then later we'll start adding more research to actually justify what works and how, so that more women over the world can be helped.
That's true. And in fact, in pregnancy, most women, if they're having a lot of discomfort, they would just think it's because of the expanding uterus, their expanding belly, and they would think it's all physiological, it's normal, part of the pregnancy journey. And any mobilization, if they listen to something like osteopathy or some mobilization, they would feel it's very unsafe to do that for the baby, or just in general also. So how would you break that misconception which most of the women have, that they have to live in pain, that pregnancy would be tough and they shouldn't be reaching out to any manipulation techniques?
I think one of the important things that we teach in women's health osteopathy, we actually spend a lot of time in, is actually intuitive approach to treatment. Intuitive in the sense that you really can, when placing the hands on the body, you apply the minimal required pressure to achieve the maximum required result. So you actually create a safe space where the techniques are very gentle but very effective for women. And whenever a woman comes and she experiences that um, very direct, effective contact, yet very gentle and light. It's a very unique balance. They start feeling safe, and you can actually see that they start to relax and trust the process. But of course, there are a lot of people who work in a more harsh way, which is a bit more frightening. But I think every woman should know that if you find a very good osteopath who is trained in women's health and pregnancy care, they can gain so many benefits. And actually, before I came to India, I had a conversation with one of my clients, and she had a baby. She had a baby around 1 year and a half ago, and then she was reflecting on this journey of her pregnancy, and she told me that, Kes, one of the things that I was very grateful for is having you helping me out through the pregnancy process, because treating pregnant women is not just about managing the pain or making them feel more comfortable. There's also a lot of communication, education, support. Women have many questions during the pregnancy. They may not know the answers. They might not know what is the pregnancy plan, or what might be the things to think about at every week of the pregnancy. And then you can help women to answer those questions, or rationalize some of their fears, so that maybe if doctor said something, you can explain in different words because you have more time with them what it really means. So I think it's just, again, it's more than some of its parts. It's not just about treating pregnant women's complaints, but seeing a person as a whole person with body, mind, maybe even spirit connection, and then addressing every need as it comes along during the session.
I have one such story. Like, I was assisting one of my close relative, you can call, in her water birth. So the midwife we had was from UK, and she was very sweet. She knew what osteopathy was, and I was giving her osteopathy sessions. She was almost 41 weeks, 5 days, and she was like, "I'm done now." And I was actually giving her osteopathy sessions, and after that, the next day she went into labor, and I was there the complete time. She opted for water birth, and that has made smooth in terms of her pelvic opening also, and it was an encoil birth as well. So I have seen live for the first time that having an osteopath in the birthing room, how much difference it could make in terms of them to undergo that process, in terms of the pelvis opening. Like her labor duration, like being the first time mom, it could go up to almost like 16 hours, and it was 12 hours. So it has decreased. I mean, in that the active labor would be even for a shorter duration of time. So, and she just had like a minor perineum tear. It wasn't big also. So, all that process. And the midwife were also very understanding. The doula was also there. So, they were like just push. They were like just breathe, let it come naturally. So there I actually firsthand saw how much of a difference it makes in the environment, like having a supportive group, like having a tribe, be it gynecologist, be it a midwife, be it a doula or osteopath. So how they can all integratively actually support that process.
Absolutely, and we have, that is why it's called integrative care. We have so many different specialists in healthcare, and instead of dividing like I only do this and I only do that, we should find a way how we can integrate and get the best out of everybody. And then also to add to this, it's not just about the birth and preparation for birth, but one topic we should also talk about is what happens after labor, right? Because there's a lot of changes, a lot of recovery, but the body has gone through a lot of changes. The body has gone through a lot of down pressure, and a lot of women, they're experiencing issues really after birth. They might start getting problems with the bladder continence. They might have issues with pelvic floor pain. They might have general little discomfort in the abdomen and stomach region. So we also need to find a way how we can support women after birth. And osteopathy has a lot to offer for that as well, which is very fascinating. And we have learned some of these techniques in this training in the last few weeks.
So most common issue which I've seen after giving birth for most of the first time mothers is the responsibility which gets added on, which they were not prepared for. So be it postpartum depression or the anxiousness of just feeding the baby every 2 hours, no sleep, and they have to take a break from work just 6 months, and then they have to go back. So actually they don't get the time to rest or recover, and most of them, they come up with a very flaccid tummy, where the stretch marks are there. The tonicity is gone. So because of that, they start facing a lot of issues, because their diaphragm is also more opened up, the ribs are open, it just didn't go back. So the body is still in that state when they were pregnant, even after 2 years after delivery, and it just stays that way. That I think it stays in the system somewhere. And
Yeah. And I think here what you have pointed out are two very important questions: physical health and mental health.
yeah,
That's a summary of what you've just mentioned. And, I sometimes give this example, like you can have a more natural birth and you have assisted birth with C-section, for example, right? And then I give this example also to people, like if you have any surgery anywhere in the body, like if there's a shoulder injury or knee injury, you have a, let's say, meniscus tear, and you have some surgery done there. What is the next step that you will have after the surgery is you have physiotherapy and rehabilitation, right? So now, when it comes to women after birth, what is very interesting, when you ask how many women did have any rehab after that, the answer, the number is very, very low. And this is very surprising, and this more awareness and education is important to spread about this, that, after delivery, women should go and find a way to find time to also care for themselves. It's very difficult, from what the women shared, that yes, you have a new child, there's a lot to do, you don't have time for yourself, there's other responsibilities to manage that. But it's very important to find a way within the family structure to give the space for women to actually care for themselves physically. And also mental health. There's kind of some countries where mental health topics are very open. A lot of people are seeking help. And there are still countries, unfortunately, where mental health issues, postpartum depression, there's a bit of stigma associated with that. But, you know, the happiness of a child and the family also depends on the wellness and happiness of a mother. If the mother is not feeling well within herself, it affects the child and affects the environment around that. So even more important for women is to have the support, also like a team support, having, of course, understanding family network, friends network, but also physical health support, supporting through osteopathy, recovery, exercises, and mental health. I think all of these things should be tied in together.
So right now in India, at least, since osteopathy is still growing, it's not available at everyone's place or at everyone's comfort. What would you suggest to the new mothers? Like some things which they can do on their own. Like we do have few Indian traditions, like after birth, they're not supposed to touch few cold things. They have to keep their ears covered, or they tie a big cloth around the belly, like from the hip, to keep this abdomen, which got the rectus muscle, which got open, to close, so that there's no energy leak. That way also, so that everything, whatever water retention is there, it just comes out. But most of them, after that, they just know that they have to do Kegels exercise, and later there's no knowledge in terms of how to recover from it. So apart from osteopathy sessions, I mean, of course, that's a major solution, but what else can the woman do herself?
I probably think that there are other professions, even within India, for example, that women can seek help to. There are some really good physiotherapists, that you can also find for the time being. I think generally the first thing is to actually, even before you give birth, to schedule an appointment maybe 6 weeks down the line with somebody that you would not miss. Because I noticed that if this doesn't happen, life just gets in the way and then women forget about themselves.
Yeah.
So really finding somebody good that can help you, to examine you, to check that everything is fine afterwards, and then maybe even start doing some exercise with somebody that you actually trust and has very good recommendations. I'm saying more like very good specialists. And then also, it is very small, I know that, but I think that osteopathy is going to grow much more in India very soon. And you can fly everywhere in India, so even coming to SSU and seeing students who have been trained in this will be so much helpful for them.
Yeah. I actually see that people are just waiting for more osteopaths to be graduated, because the kind of health we provide, I mean, it's not just putting them out of the discomfort or pain. They're also living more healthier lives, so they want that kind of care which we are providing, so they're just waiting to have it in their vicinity. So I can actually see a lot of growth and experience in this area. But at the same time, what would your insight be for science aspirants who don't know that this field exists, or this could be an option, since it's still growing? And in fact, in this November, we'll be celebrating 10 years of osteopathy in India.
I think the important thing, what we've noticed in the UK, because osteopathy has been there for 100 years, over 100 years now, is that it's really important to keep the identity of osteopathy. We should understand what osteopathy is, and we try to keep the root values of osteopathy as we go along. Because what can sometimes happen is when osteopathy tries to blend in with very typical evidence-based research patterns, instead of starting focusing on the whole body system, we start working more on specific areas of pain, and we're trying to see how osteopathy is something similar to maybe physiotherapy. But I think it is very important to see osteopathy as another form of medicine, which is, it has its own philosophy. Ayurveda has its own philosophy. Chinese medicine has philosophy. Western medicine has philosophy, and osteopathy has its own philosophy. So maybe sticking more to the values of what osteopathy is, and trying to develop a clear communication to the public, and at the same time working on research and creating good quality research on how osteopathy can help people. I think this is very essential in the beginning of osteopathy to create good foundations. And I think one more thing I would add is collaborating with current medical professions. Instead of seeing this as, oh, medical professions are separate and we're separate, actually we can complement each other so well. And even in London, if you have people after surgery, some surgeons will send patients for osteopaths and not physiotherapists, depending. Or if you have very chronic complex patients, you might actually, once patients have seen physiotherapists and it still didn't improve, you would see an osteopath, and that can help a lot. So that collaboration with medical field, I think, is also very important.
Right. Well, I think it's getting too intense. So, on a very light note, should we do a rapid fire? I actually prepared some.
It can be a quick question, but very long answer, so I don't know how it's going to be.
That's why it's called rapid fire.
Let's
Like,
try.
how rapid can you be? So, what would be one of the most common misconception about osteopathy you want to clear up?
Okay, I think a lot of people see osteopathy in association with cracking the backs, like chiropractors would do. So I think this is the biggest misconception. Some osteopaths do practice like this, but actually osteopathy is much more than that.
Yeah,
You're
but
seeing body as the whole unit.
osteo translates to bone, so they think it's something to do with both. And what's the most rewarding part of your job?
The most rewarding part of the job is when people who have been living in pain for many years, they actually start living pain-free lives. And when people, express their gratitude for the work and that it improved their life quality, it is actually very rewarding.
Yeah, their blessings feel too good. Like they're just pain free. It's like, oh my god, I'm blessing you so much. You do well, and I feel so good then. What's the one thing the public should know about their own body?
First of all, they should just know a little bit more about how the body works as one mechanism. I think that's what people should know. Instead of thinking if I have a shoulder pain, people think we need to treat the shoulder. But actually, I give an example in my teaching that, if you have the domino pieces and you push one and so many domino pieces fall, the last one to fall is going to be your pain. But actually everything else before that is where osteopathy has to focus a lot. So I sometimes say that 95% of treatment on the body, it's not even touching the area that hurts. So getting a bit more understanding of how the whole body functions together, I think would be very beneficial for.
If your body is like a unit, so let's say if your body was a car, which part of it would need the most servicing?
It really depends. Of course, most people the physical complaint that most people experience will be like lower back pain, neck pain, and shoulder pain. This is very common, but we also need to remember what type of car. There's a family car that stays in the garage for a week, and once a week they go out somewhere. You have a racing car where you need to perform a lot, and you might also have a tractor that needs to do a lot of heavy lifting. So the beauty of osteopathy is you can actually adapt the treatment to individual person's needs. And if you have a Formula One racing car, you might actually do treatment even during the intense physical training or athletic performance. Whereas if you are having a person who is living a more sedentary lifestyle, you can find a way how you can support that function of the body best to prevent pain from happening.
Now, when you put it that way, it's more easy to relate. Which car am I driving?
And that car changes probably for the same people might be driving different cars.
And maybe just for a change, sometimes I might just take a public transport. I don't want to drive. Someone else drive me.
Yeah, so then we need to service that on public transport as well.
What is your go-to remedy for a tired day? Maybe not masala chai, but something else.
In India, like masala chai, it's actually meditation. Sudarshan Kriya technique developed by Art of Living and Meditation is the number one thing that I do every single day. My life schedule is very busy. I treat a lot of patients. I travel across the world. And the one thing that keeps my energy high is Sudarshan Kriya, sky practice. You can learn it in every part of the world, and meditation.
What's one simple habit for a better body health? Like a healthier body, maybe?
I think actually there are a couple of things we should focus on. First of all, we should focus on our fitness levels and exercises, taking care of the machine, right? So osteopathy is really good for servicing and getting some gym and strength training, cardio exercises, stretching is really good for the body. We also need to understand what type of fuel we put in the car, so the quality of food is also very important. And then the driver, the mind, management is also important. So what I'm trying to say is if we can do some exercise every single day, if we can service the body to prevent pain from happening, if we can have good food and avoid any unhealthy habits, and we find a way to support our mental health, I think we're going to be living 99% healthier than most of the population in the world.
So right now there are many people having different kinds of aches and pains. Like, what hope does osteopathy give them? Like, in terms of maybe percentage, how much relief or hope can it give?
I mean, there's a lot of hope. A lot of hope. I have seen a lot of patients, and the patients that I tend to see can sometimes be very complex. And I like from all the patients that I have seen, out of hundreds of patients over the years, only maybe one or two were very difficult where pure osteopathy couldn't help to improve that. But I can almost say like 99% of the times, osteopathy will make a significant positive change. And for most people, it will actually help to resolve the problem.
That's a very huge percentage actually. That's pretty cool. And so maybe if you fast forward like 10 years into the future, so how does osteopathy look for you in India like 10 years from now?
I think it really depends on the growth, but I think if we have the good framework and we have enough people trying to learn something new like this as osteopathy, I think I would really love to see osteopathy at least in bigger states in India. At least one clinic per state, that would be really, really nice. And then we can expand from there.
So you would have to come more often to lay down the structural work.
Of course. Of course, that's why I'm coming here.
So you have developed your own way of teaching also. And in November, you'll be taking a workshop on advanced spinal care.
Yes.
From 2nd to 4th or 5th November, right? Okay. So what are you going to teach in that? It's like, with very minimal pressure, how can you get maximum results? Like how we were talking, is it in those terms?
Yeah, exactly that. How can you be the most effective in helping people with spinal complaints? These are one of the most common reasons why people actually seek for help. And sometimes we can get stuck or it takes a bit of time to help people. So to give perspective, we will learn a couple of things. First of all, we will learn how to diagnose pain when actually we see what structure causes pain, and we also assess whether there's something serious that we actually shouldn't treat and we should refer to a doctor. So we will learn that framework. Then we will also learn techniques to realign the balance of the joints and the fascia, supporting the whole spine from the neck to the sacrum and the pelvis balance, so that every single part of the body is aligned. And this really makes the recovery faster. It's like if we could get that result, like in 2 minutes, you can solve a person's pain that has been there for like a couple of months or years. I think that would be a really good outcome. So we will learn this. And lastly, we'll also learn some exercises that we can prescribe for the patients so that not only we can help them whilst they're coming to see us, but what can we actually give them so that they prevent pain from happening in the future.
I think exercise is a very important aspect here because most of the exercises which people do, at least in open gym, and especially it's the elderly, it's very unsupervised and they don't have the right knowledge and they just do it in a different direction. I mean, you should see once. It is sometimes very funny. I get scared like, oh my god, you're gonna enjoy yourself more. But yeah, I think that really helps because most often when it comes to a age where like just 50 and you start having stiffness or something, then you're like, yeah, it's age related, it happens, it's common. But I'm like, no, it doesn't start that soon, because before it was at least 60, 70, now it just came down to like 45, 50.
I think if we add this analogy of the car again, it's like, if you buy a car or a tuk-tuk or any vehicle in India, what would you expect to do? You would still like to service it once in a while. Right. That, at least the wheels are pumped up, so it at least can function well. So what is interesting about the body, that we got this body once, but for 50, 60 years, we haven't had it ever serviced. But once you have serviced the body, you might think it's 1960 Ferrari, but it's still a Ferrari and it can go very well. So all we just need to do is just restore the balance, and you can actually experience that energy and freedom of movement once again that you may have never not experienced a long time.
Now everyone can relate to your Ferrari analogy. Well, I think I have pretty much asked everything I had on my mind. I mean, there are a lot of things, but I was like, let me keep it a little short.
So maybe let me ask you, like, what do you like about
Okay, oh my
osteopathy
God.
most?
What do I like about osteopathy the most?
Mm-hmm.
The first part would be communicating with them, like, just listening to them. It really resonates sometimes. And then, after treating them and after seeing how the pain has resolved, and then again listening to them. So that is the best part.
Mm-hmm.
That is what actually gives me a lot of, I don't know, a lot of motivation. Like, this is it. I'm on the right path. This is going to help so many people, this kind of care.
Mm-hmm. For sure, and you've just graduated quite recently. You just
Yeah.
started practicing, and you're already getting some good results and great results. And I think it would be really nice to that. Well, hope we'll see who listens to this. But if there are any people who are actually about to graduate and they're thinking what profession pathway to choose from, I would really, really recommend exploring osteopathy, because when I teach in Europe and other countries, sometimes in my group and audience I see doctors and I see physiotherapists, because they also want to learn some skills to help their patients better. And what some people actually say is that osteopathic knowledge contains the center core where every other system that you have learned will be integrated well into that whole system. So what I'm trying to say is that osteopaths can also prescribe exercises. Osteopaths can
Right.
also learn techniques how you can use dry needling. You can also manipulate the joints in the spine. You can do that. But other professionals cannot do what osteopaths can do. And I think even though it's growing new, the demand is also getting very, very high. And in India, what I've talked with you whilst I was here is, if you help one person to resolve a problem, there's so many people that know each other that they will just send 10 more people your way. And it's still more focused on the private practice. And not only the setup costs of a treatment room are pretty low, being a healthcare practitioner, but even graduating very soon, you can actually earn a decent living quite early on in your career, which is amazing, so that you can actually do more things and open up maybe your clinics in the future, etc. So I know that in the beginning it's challenging. People sometimes find it is going to be working for them, but actually I would definitely recommend at least coming to Open Doors at Trish University in India and just checking in whether that would be something that they actually like getting themselves involved into.
Right. I didn't know that your whatever practice, it was open for some other streams also apart from osteopathy. How did they perceive? Like, did they understand the approach, the principles you were trying to apply?
Yes, a lot. And I just finished one training in Lithuania in August, and then we were receiving some testimonials from some of the participants. And then I had a rehabilitation doctor in Lithuania sharing his experience. So the course lasted 10 weekends, so there was like 20 days in total. And what he said in the testimonial he shared, that in those 20 days, what you learn, it is sufficient enough to start implementing and practicing and achieving great results in practice. And when I asked him and I said, like, oh, can you share with me how much percentage of the work, manual therapy work that you have learned, you implement in your practice every day after doing the course? He said 80%. So, my vision at the moment that I find is have a few options and choices, but the knowledge of osteopathy is already there. And in different countries, we have people who have already been in their practice for 10, 20 years. They're most likely not going to become osteopaths, but still teaching them some principles and some techniques that can actually aid patients' recovery, I think it's much more important than just keeping that knowledge aside. So, yeah, it actually works very well for studying osteopathy and getting very deep into it, but also possibilities of learning something a little bit to really enhance your clinical thinking and your treatment outcomes.
So right now for this November workshop you'll be taking, it's open for other healthcare professionals as well.
No. So this November course is only for osteopaths in India.
Because we're celebrating 10 years of
We're
osteopathy in
celebrating 10
India.
years of osteopathy, so we want to
Exclusive osteopaths.
exclusively train as many osteopaths to provide even better care for their patients.
Right. It actually feels special recording this podcast in Sri Sri University, which is one of the leading motivator to bring osteopathy to Asia as a whole, and with such in-depth curriculum for both bachelors and masters, which actually aligns with the global standards, with the WHO benchmarks. So it's also easy to get into other doctor of osteopathy systems when you study in this, if you want to practice abroad also. So I feel,
Sure. There's a lot of communications happening with the UK and other countries, and to see how people graduating the SSU can also travel abroad and become osteopaths there.
for sure the future looks promising for both the public and also for the students who see it as a career option.
For sure.
Yeah.
Great.
Is there anything else you want to add? Because I have a lot of content to like just pull out of you, but I just don't want to like exhaust you. I want to save some.
Yeah, let's save something for the next.
Yeah,
the
we're going to
the
do
second part.
episodes. This is not the final.
Yeah, we'll do a second part. We also don't want to exhaust the audience listening, but I think what I'd like to do is I'd like to thank you for hosting this. It was a very nice conversation. I'd like to thank Sri University for hosting us here for the podcast. And then we'll see each other in the near future. Yeah.
I'm coming for the advanced spinal care.
Amazing. So yeah, great. I'll see you there as well. Okay.
Sure.
Thank you so much.
Yeah, thank you.
It was very nice talking to you.